My name is Dr. Diamond Clark. I am a licensed marriage and family therapist in the state of Pennsylvania. My educational background is I have a Bachelor's of Arts degree in psychology from Newman University. I have a couple and family therapy degree from Drexel University, and I have a doctorate of educational leadership from Gwynedd Mercy University. Possibly someone who can understand their experience, someone who has well-versed knowledge of social justice as well as just the justice system period and the experience of a minority and what that may look like, and being able to be culturally sensitive. I think cultural competency is very important. Being able to understand that just because I may present to you this way now, that may not have been my experience back then. And so that person still may carry some of that with them, and being able to be sensitive and understanding and asking clarifying questions so that you can be empathetic to their need is important. I also think language barriers, because minority is not just based on race or ethnicity. It's also language as well. So if you don't have someone that speaks a language that you're comfortable in, that can definitely be a barrier or a challenge, or even like interpreter services, that can even be a concern. I think having someone who is friendly to different populations, such as LGBTQIA+, the community. I think as a therapist, it's important to be culturally sensitive to different communities. Again, minority groups do not just mean a race or an ethnicity. It can also be a language. It can also be the way that you identify your eating habits or your body image, or the way that your sexuality presence. Minority can mean anything. And so being able to have providers that are sensitive to that is definitely important as we continue to build this practice. Yeah, if you are not culturally aware of how, for example, for different cultures, grieving can be seen very differently. So if you come from a culture that sees that, the person who has passed away has not really passed away, and that their spirit still lives on and you still feel their presence in their home. If you're not culturally aware, you can diagnose that person as having hallucinations or delusions. Being culturally sensitive is so important if you are in this field, being a practitioner or a clinician of any kind. You have to make sure that you understand who your client is. So asking the questions, asking how their culture celebrates life after death, or how they come into how they grieve loved ones and what that looks like. In the African American community, some people wear white to funerals instead of black garbs. So, being sensitive to that is important. I mean, look at the media, right? The media definitely continues to have stories about just disproportionate stories of a minority's experience. So being a minority and showing up in the field, you need people who look like you. One thing that I really appreciate, you're not just seeing one particular race or background. You are seeing a multitude of races and backgrounds, from our doctors to our nurse practitioners to our physician assistants to our leaders, as well as our front desk staff, as well as our therapists. We are a very mixed culture, full of different diversities and full of different ethnicities and cultural backgrounds, which I think is very important. You are seeing people who may look like you and who may inspire you to take on your own mental health journey and, maybe even get into the field.